Hey everyone, welcome to the Doc Wishloff Podcast. This is episode 1. You are on the ground floor. We're taking off together. I decided to start this podcast to bring up some different topics to discuss. Yes, I like evidence and research, etc., but there is a lot of stuff in this profession of health, wellness, injury, etc., that there's not a lot of evidence for stuff that works pretty darn well. And I know for me as a practitioner, most of the things that I have learned have been in rooms with different practitioners with lots of experience, rooms with trainers, nothing formal. Formal education is really, really good to be super safe and understand risks, because that's really predominantly what they're focused on instructing you on, right? Like the risks of something, understanding when something could be a potential indication of what we would call a red flag, right? Something super dangerous, cancer, heart problems, etc., right? Something that imminent death is coming. We want to be able to identify that. But outside of that, we really want to start to understand that there's a lot of different ways that you can help someone. And I wanted to open up this conversation on a podcast forum so that, first of all, people have an opportunity to have a discussion. Yes, I'm going to pull from research, and yes, I'm going to pull from different things, but I think having a discussion of what works in the industry that doesn't get restricted by the confines of evidence-based everything is really important. And I also think it's an opportunity to share a deeper context for some of the things that I post on social media and some of the things that I do with my clients. So that's really what this podcast is going to serve to do. A little bit about me and my background if you don't know me. My name is Dr. Kirsten Wishloff. I have been a chiropractor since 2016. I worked as a personal trainer, yoga instructor, kettlebell sport person, whatever you name it, fitness industry, weightlifting kind of lady from 2010 till 2016. So I kind of had a career before a career. And then once I was into the world of chiropractic, I also took functional acupuncture. I taught with active release for a number of years, the soft tissue technique. I've taken all sorts of courses, helped teach lots of courses, and at this juncture, I'm transitioning to, the business side of things. I run my own clinic, helping as many people as I can through exposing more people to my work online, and trying to get more practitioners up to speed on some of the stuff that is not always taught in formal schooling, and giving them an opportunity to experience some ideas that I wish I had been exposed to younger. Prior to all of this education stuff, so I have a Bachelor in Physical Education, it's called, from University of Alberta. I have lots of I took my yoga instructor training, etc. I really like to expose myself to a lot of different ways to perceive and understand movement. Prior to all the schooling, I was a multi-sport athlete, so I played both soccer and volleyball in university, and had just generally been an active person. So I myself had experienced a lot of injuries. I myself had experienced a lot of the formal side of rehab therapy, etc. I had seen everybody, everything, tried it all, spent lots of monies. And I think I got into this field because the stuff that I had didn't fall super well within the medical system as it existed. Like, it was nothing that could respond from surgery. It was nothing that was really happening in isolation. So it wasn't like I blew up my knee, like someone impacted me, I blew up my knee. It was like stuff that would just kind of show up and everyone would call it overuse. And I was like, what? What does that mean? I have to continue to play all these sports. So how do I, get it up so that it's working for the amount of use that I need to use it for? So I guess the reason that I fall deeper into the category of things that are less clear-cut and protocol-driven is because that is what I experienced in my own journey through injury. So Generally, my patient population is a lot of people that tried the standard approaches and are ready to tuck in for a deeper dive into all different reasons why they might be having problems. What came to my mind actually when I was thinking through what I wanted to chat about on this podcast, and one of the things that I see a lot that is missing from standard approaches is the understanding that not all things are biomechanical in nature. So whenever I look online and I observe movement assessments, people are quick to be like, this is short and this is long, and we've got internal rotation problem here and external rotation problem there. And they'll observe movement, and yes, they're picking out the pieces that are looking short and long, etc. But I've never seen anyone on social media observe, say, like a slouched forward posture and suggest, oh, maybe that person has an issue with their esophagus. Maybe there's inflammation through their digestive system. Maybe that is why they are rounding forward. And maybe it has nothing to do with biomechanics at all. And these are the conversations that I want to have on this podcast, because I think there is a huge gap in the understanding of how visceral, so like digestive and stuff going on in your organs, how that's impacting the biomechanics of things. Understanding nerve biomechanics. Maybe they're slouched forward because they have a nerve entrapment at the foramen in their neck, and the certain position that they're in is actually opening up space for that nerve root. I think unless we have these conversations and gain a clearer understanding that there's a lot more going on than just biomechanical tension lines, that's the only way we're going to make any meaningful progress and stop missing these key indicators of a problem. And so when I discuss online talking about the root cause, like what is the problem that is leading to this, is yes, we can observe the biomechanical principles of what's happening, but we have to take a moment to understand that there could be stuff going on that is not joint, muscle, bone, range of motion. Because a lot of the time, this is what is missing when people come and see me and they're like, oh my gosh, no one had addressed that, or no one had connected my endometriosis to my back pain. It's because people are not taught how to do that in formal schooling when it comes to manual care. So I have created this podcast as a means to explore some different ideas. Yes, we're going to discuss injuries. Yes, we're going to discuss research, but I'm going to do my best to expose you guys to some new ideas, some different ways of thinking, so that you can approach a problem, whether it's in your own body or within a client's body, with this lens of patience and an order through which we can observe these problems that's going to be productive and is not going to have you missing things all the time. So I'm super excited to have you guys here. Thank you for coming along. It is extremely helpful when you are running a podcast to get reviews. So if you have a moment, give this podcast a review, write a comment. Please send me a message if there's particular topics you want me to cover or guests you want me to have on the podcast, because I'm doing this for you, to expand your knowledge, to expand options so that you're not feeling stuck with your clients or stuck within an injury in your own body. You have a path to progress, and you have some different places that you can reach out to for help. So excited to have you along for the ride. Thank you for listening into this first episode, and looking forward to having you here.
Once again.